Newsline.
Very good evening and welcome to another edition of Newsline Live, coming to you live and direct from our News First studios in Colombo. Our guest this evening, Dr. Ashan Pathirana from the Health Promotion Bureau. A very good evening, Doctor, and welcome to the show.
Good evening, Shannon.
Doctor, we're living in the new normal. COVID-19 pandemic has ravaged not only Sri Lanka but the rest of the world as well. But there is a glimmer of hope with, of course, the vaccine beginning to come into Sri Lanka. What is the progress like of the vaccine rollout program here in Sri Lanka? Is it taking place smoothly? How are we doing?
Okay, so let's start off by saying the COVID vaccine is like a new arsenal in our armory, right? You know, so now we've got like a new weapon. We won't say that it's going to replace the other measures that we have taken. So while practicing all the other measures that we've been practicing to prevent the spread of this disease, this is a new weapon that is in our arsenal now. So with that, we are very confident that this would eventually lead towards the light at the end of the tunnel. But then again, we are far from it. We have just started off the process and it's been really, really good. The response have been excellent so far, and the vaccine take-up has been going up very well compared to other countries, and we are in good grounds.
Doctor, so far, by the number of people that have been vaccinated, how are the results like? Are there any side effects? Were these side effects expected? Is there something to be concerned about?
So the major thing that we would be worried about would be allergies, severe drug allergies that might lead to a lot of complications, which we have not experienced up to now. So that is a good thing, and I got the vaccine myself 2 days ago, and today here I am. So I had a little bit of fever, some body aches, not even without paracetamol, I'm recovered, and here I am today. So that is expected. It was there in the stage 3 clinical trial data that the common side effects were the injection site swelling, some difficulty in the arm, and then fever, some chills and rigors. Those things were well documented and exactly what we went through.
Right. So besides that, there are no other issues, at least in the program that has been conducted here in Sri Lanka.
We still haven't come across anything major. So just these small issues, but no major drug allergies or anything, which are also documented. Like in any vaccine that is given, even for the children, these things are well documented, that there are drug allergies and there are ways to mitigate it as well. That's why we have an emergency tray with every vaccination center. And we are prepared even for this, but still, so far so good. We haven't had any of these issues, major issues up to now.
Of course, the story is a little bit different on the global scale, because in Norway, there were a number of people, a number of elderly people who passed away within a short time period of receiving the COVID-19 vaccine, AstraZeneca. However, the World Health Organization came forward and said that there is nothing wrong here. What really happened here?
So that's the thing, we need to look at things in a statistical way. Like, you know, statistics wise, when you're giving the vaccine to 40,000, 50,000 people, we have to account for the people who would eventually pass away in a study group. So some of these elderly people were having end-stage diseases, which would have eventually led to an outcome within a few months to weeks. So sometimes, unluckily, these people, the death of these participants coincide with the vaccination. But the job of a scientific evaluation is to see whether these people are actually, did this happen as a result of the vaccination, or is it due to chance alone? So when they analyze with the numbers that were vaccinated and the people who had the fatal outcomes, it was purely due to chance. So it was nothing related to the vaccine.
Well, judging by the number of people who can receive the vaccine, those who are eligible for the vaccine, of course, first comes the frontline workers, the health professionals, the triforces here in Sri Lanka as well as across the globe. However, children under the age of 18 and certain other groups in society are not eligible to receive this vaccine. Why is that?
So that's a very good question, because a lot of people think, are we sidelining these people? Are we saying that the children and the pregnant mothers and the lactating mothers should not get the vaccine? See, the issue is the scientific evidence is limited, right? So the trials have been conducted on people above the age of 18, and they have omitted the pregnant women and the lactating women from these studies. Therefore, we do not have data with regard to these age groups and these categories, and therefore we cannot recommend it. So in due time, when scientific data is available, these age categories and these categories might become eligible for the vaccine. But right now, since it is at a very early stage, the studies have shown that it is affecting in certain age groups. And therefore, we'll have to stick with the available science. And as things evolve, these things will change. Anyway, the priority groups, next would be the elderly. Right, and then in a cascading model, we will come to the lesser risk groups, and hopefully by that time, we will know whether the children are okay to have the vaccine.
Although the vaccine is here in Sri Lanka has been here in Sri Lanka only for a short period of time, the vaccine rollout programs in many other countries began a few months before it began here in Sri Lanka. What is the update on the global situation? Has the vaccine really put a dent in it, or at least made some progress in reducing the number of cases?
So, Shannon, what has happened is the global situation. If you look at the WHO, the weekly epidemiological report has shown for a third consecutive week, the number of cases in the world have come down, which is a fantastic sign, because we know that they're at the height of winter, and with the snowstorms and everything coming about, the number of cases are coming down. So, it is a good sign. And in Israel, they're showing some very significant results, which had the fastest rollout of the vaccines, and they are showing a 60% reduction in the cases that they're detecting. So these are all good signs indicating that these vaccines are doing what they're supposed to do. So hopefully with more and more vaccines getting approved and the access to vaccines improving, we will see this scenario, unraveling really fast throughout the world.
The number of COVID-19 vaccines that Sri Lanka has currently received, is this enough to make any progress on slowing the number of cases in Sri Lanka?
I don't think so. Right? So what we think about, we speak about what is called a herd immunity to actually put a block on it. But then again, before that also we'll see a reduction in the burden. But if we are to put a stop to it, we'll have to achieve herd immunity. But it has started within the healthcare workers who are at the highest risk. Because I think the GMO announced that over 100 doctors have got infected with it, and I think it's the same for the other healthcare workers as well. So apart from the healthcare workers, the frontline defense people and all the other groups that are involved in this management are getting the vaccine, which I think should be a priority, which allows them to freely engage with their work. So the next step, hopefully we are expecting the government is doing a fantastic job trying to procure these vaccines, because we have got the vaccine right now in Sri Lanka, at least for the healthcare workers, whereas some countries like Australia still haven't started their vaccine rollout. Right? So that's a commendable thing. So that part of procuring the vaccine is a diplomatic job. Right? We can recommend, we can approve, but then it's up to the government to do their part to bring in the vaccine, which we can see is happening. And hopefully they will be able to continue this job to ensure that a majority of our people will have access to the vaccine.
Well, when we speak about vaccines, there are a number of vaccines that have been produced globally. Why are these different? How are these different? Are there vaccines that are more suitable for Sri Lankans? Will these be taken into account when the vaccines are approved or procured for Sri Lanka?
Right. So, Shannon, we are talking about two main arms of the vaccine. One is the mRNA vaccines, the other one is the viral vector vaccines. So the thing with the mRNA vaccines is that we are not having the logistics to maintain the cold chain at -70. So that's going to be a bit of a task. And on the other hand, we have...
And if this cold chain is not maintained, does it become dangerous for a person's health?
Not really dangerous, but the vaccine becomes ineffective.
Right. So there's no point.
Yeah, it's like giving water.
Okay.
Right. So in that case, the viral vector vaccines like the AstraZeneca and the Sputnik 5 that they have been discussing are both viral vector vaccines, which can be stored at the normal refrigerators. So which becomes very much easier given our logistics to have that vaccine to be rolled out in Sri Lanka. But then again, we are not keeping anything out because it's not impossible. So even right now, all possibilities are being considered by the government, because it has to be a cocktail of vaccines that will have to fulfill our need. So we are not going
There is no scenario where every Sri Lankan will get a single vaccine.
I think it's very unlikely. Not in the US, not in Australia, not in the UK. They are all trying to get their hands on anything that is effective.
Right.
So in Sri Lankan terms, the NMRA will approve the drugs that they think are suitable. So right now it's only the AstraZeneca that has been approved. But in due time, considering the logistics and everything, they will recommend the other drugs as well.
Of course, all our viewers out there can send in your questions that should be posed on this show to the number that's being displayed on your screen. We've actually received one question. Will there be a situation where a person may get a mix of different vaccinations? Is this possible?
No, because right now there is a scarcity of evidence. But to tell you, there are some vaccine trials that are going on about, like say for example, the AstraZeneca and the Sputnik 5. They are having some
Can they
trials.
coexist?
Whether we can use AstraZeneca as the first dose and probably give the Sputnik 5 as the second, because they are both using an adenovirus as a viral vector. And so some literature says that using two different viral vectors would give a better outcome during the two. I mean, these are all theories. So whatever the theories need to be proven by science. So that's why we have the stage 3 clinical trials where you have to use it in a placebo group and an intervention group and prove that it is more effective. So with new evidence, we might be able to offer two different vaccines based on literature.
Also, doctor, now when you said you already received one jab of the vaccine that is being rolled out here in Sri Lanka, but you were wearing a mask. Now there is a question that has come in. Can a person who is vaccinated with both jabs of the virus transmit the virus to another healthy person?
Right. So that brings us to some details about this vaccine. So there are some vaccines where you can, they're called sterilization immunity, where you can achieve 100% cleanup, where you get the vaccine, you have complete set of antibodies which will really eliminate the virus if it tries to get into your body. But some vaccines that have been used even in the past, which have had fantastic results, like the polio, it's not a sterilization vaccine, but it weakens the transmission, it supports the person to recover. So the infection can get into your body, but to give out the disease, the chances of getting the disease is very low. So this AstraZeneca vaccine, they have shown that the people who got the vaccine did not get any disease that required hospital admission. So the sample size was over 11,000, and in those 11,000 people, they didn't get a single person who required hospital admission, which is fantastic. This is what we want. And then comes the problem. People ask, okay, then they are asymptomatic. Would they go around spreading this disease? The answer for that is asymptomatic people have a lesser chance of spreading the virus compared to the ones who are actually having symptoms. So the lesser the viral load, the lesser the chance of spreading. And all of them put together, the vaccine is doing what it's supposed to do. And if we have enough coverage, we will see an end to this. So till that point, I have to wear the mask. I have to practice all the other precautions.
Even if you have received two jabs of the vaccine.
Yes. So as I just said, I might get the infection, but I might not get the disease. But then again, I don't want to take that risk of spreading it, or.
But you can spread it.
Well, theoretically, that's why we're saying. So these are very early stages of scientific evaluation. So we are taking every possible measure to curtail the spread. Therefore, we will stick by the rules, and as more evidence comes in, we will get better updates on it.
Well, we're in discussion with Dr. Ashan Pathirana from the Health Promotion Bureau. We will be right back after this short commercial break. Don't go anywhere. You're watching Newsline Live.
News First, Newsline. News First, Newsline.
Welcome back. You're watching Newsline Live. Dr. Pathirana, we were speaking about, of course, the COVID-19 vaccine. Everybody in Sri Lanka, many people are eager to get this vaccine and to get themselves protected from this COVID-19 pandemic. We open the floor for questions from our viewers out there, and there has a question has come in. Is there any screening that people have to undergo before they get vaccinated?
Yes. So each individual will be assessed by a medical professional to see if you are eligible to get the vaccine. So there are certain contraindications that has been set out, including any vaccine reactions for previous vaccinations which have been considered as a contraindication where you will not be given the vaccine, and there are some other cautions that have been thrown into it. So those things will be considered before giving the vaccine, and if you are under those caution categories, you will be given the vaccine under controlled environments where all facilities will be available for handling a possible reaction.
Also, Doctor, schools have begun to reopen. Students in the sitting for their ordinary level examination this year have already begun schools, and schools are gradually reopening. There were a number of cases that were reported in these schools. Has the Health Promotion Bureau taken any steps to inform the authorities at these schools on how they should conduct themselves and function under the new normal, since this would be one of the first times that schools completely open up after the COVID-19 pandemic hit Sri Lanka?
So the Health Promotion Bureau has the mandate to cover all settings in Sri Lanka. So schools are one of the key areas that we focus on. So there have been leaflets, posters, everything designed and already disseminated to the schools. So I think, there are changes in the way people get access to it, but it has already been disseminated and it's widely available in the schools. But if there is any shortage, they can directly contact the Health Promotion Bureau to get this material, and most of them are available on our website and our social media channels.
Right. Also, Doctor, there is a suggestion that has been sent in as to if the Health Promotion Bureau can send audio clips to the COVID-19 control committees that have been appointed in these schools. Would you be able to look into it?
Yes, definitely. So that's a type of engagement that we're expecting from the public. See, the Health Promotion Bureau is there to fulfill the needs of the public in terms of health education and health promotion. So if there's any request, if you can communicate it to the Health Promotion Bureau, and if we realize that it's a national lead, so we have a hotline, a 24/7 hotline that is operated in all 3 languages.
Right.
So sorry, 1999. You can call that number for any health-related matter and get support. So we are there to help.
Doctor, we're also speaking about, getting the vaccine. You said that there are countries that are way more developed than we are, like Australia and New Zealand, who still haven't begun their vaccine rollout programs simply because they don't have the vaccine. What really is the issue here? Don't they have enough money to purchase the vaccine? Is it a lack of resolve? What's the issue?
So we are facing with a situation called the vaccine diplomacy. So the countries that are producing the vaccines are using it as a tool now. So they are talking about vaccine nationalism, where they are thinking that their countries should get it first and the others should not get it. So there are issues like that. But amidst all that, Sri Lanka has been able to procure these vaccines, and I think Australia knew this is coming, so they have their own facilities for producing the vaccine, and I think they're thinking about starting it off towards the end of this month. So they are using a cocktail of vaccines, again, not one vaccine. But we have to appreciate the fact that Sri Lanka by itself is doing quite a good job in starting this discussion, like starting to get confirmations from other countries to send more vaccines in, and hopefully we will be able to have a steady supply.
Doctor, we've also received another question. You spoke about people being allergic to vaccines, and these people will be screened separately and will be given the vaccine separately under special conditions. There is a question, what are the side effects on patients of blood pressure, strokes, cancer, that sort of diseases? Are there adverse side effects in getting vaccinated?
Well, there are no specific indications for them, but general indications are there, because if you're having any blood clotting related diseases and all, because there's a whole list of contraindications. So we will share that information on our social media channels by tomorrow, where we'll list because it's a long list of things, these things are considered cautious. Right. So at the beginning, we might not actually go down that road. But then again, you have to understand, not everyone needs to take the vaccine for the country. Like, so we will, like, have a few people who might not become eligible. So we are trying to achieve herd immunity, and we need most of the Sri Lankans to come through. But like, if you are one of those people who have all the indications to not get the vaccine, well, don't get disheartened. Like, we have a plan for everyone, so you will be protected within the system.
Right. So the receiving of the vaccine, of course, the government announced that this is optional. If a person doesn't want to receive the vaccine, they can opt not to. But when it comes to certain risk groups, even if they do want to get the vaccine, but it's dangerous for them, does the decision lie with the person who wants to get vaccinated or the health authorities?
We will always lay the decision with the individual, because it's the individual right to decide whether they want a vaccination or not. But our people are literate enough. If you look at our vaccination history, Sri Lanka has had a fantastic vaccination record, and we expect our people to, believe, our guys, even though there have been certain misunderstandings about this, but vaccination is one thing that has really worked in Sri Lanka. And we know for a fact that we will have better success with the vaccination than most countries. So we have no doubt that our people will follow the lead that have been given by the healthcare professionals. We understand the disease, we understand the drugs, we understand the science, and we go through this because it's good. So,
well, Doctor, we've currently received around 800,000 doses of the vaccine, which is only enough for 400,000 citizens of our country. In a country that has about 22 million of a population. Does this really make any difference? Does this really matter?
I think the most important part is we have got a start, right? We have got a start, and the rollout process is just starting to take effect. We have 500,000 doses, right? So, but we can't give vaccination to everyone at the same time, because you have to manage the vaccine complications and everything. So it will be a gradual process, just like in other countries. And the government is doing its best to have the vaccines coming at regular intervals, and it's been planned out. Even today, there were meetings going on about these discussions. So we're expecting another rollout starting towards the end of this month, or possibly the beginning of next month. But we can't definitely say, because all this vaccine diplomacy, vaccine nationalism, people make issues about it, they bargain about this vaccine supply. So let's hope our government does the job and bring in the vaccines for us.
When you speak about vaccine diplomacy, do you mean that countries that do have the production capability to produce these vaccines are using it as leverage to maybe get other countries to do what they want?
Well, that's what the definition per se. Like, so it's been discussed world over about vaccine diplomacy, how the equity of vaccine distribution is not adhered to. So these are real life things that we have to declare, but it will actually give us good insights about how the whole world operates once we come out of this epidemic. We will also learn lessons. We will also empower ourselves to be better prepared for future epidemics, and we will be a better country coming out of this.
But of course, speaking on vaccine diplomacy and how the vaccine and the pandemic is being used for geopolitical goals, the impact on the number of lives that will be lost in the process of getting these people vaccinated would continue to increase.
Yeah, we hope that it won't happen, right? But then again, these are things that are beyond, these are like, geopolitics, like, these things happen at a very large scale, and we are simply, at a very lower scale. As the healthcare professionals, we can simply vouch that, okay, we are doing our best to get it across, give the most effective drug, but these players are operating at a very higher level, and the WHO, the UNICEF, they are doing a fantastic job trying to bring in an equity towards it, and hopefully they will do the job.
So technically, to make it clear to our viewers out there, even if Sri Lanka has the money, wants to buy these vaccines, we still can't.
Yeah, that's the case. Right? To be honest, like, it's not that Sri Lanka doesn't have money. Like, the government has already announced that the government is willing to give this vaccination free of charge to every single citizen in this country. And we are not simply depending on donations alone. So the COVAX facility will get us about 20% of the requirement, which comes to about 4 million vaccines. But apart from that, the government has pledged that we are willing to procure the other vaccines by paying whatever that is required, because that's the duty of the government. Sri Lanka has a free healthcare system, and it is our duty and the government's duty, and they will always stick by it. That you can be assured of.
Question, of course, how can Bangladesh and Nepal buy it when we can't afford it? You're saying that we do have enough money to purchase this vaccine.
Yeah, so that's what I said about the diplomacy. So some countries do get it, then you can ask the same question, why is Australia not getting it? Right? Being rich enough, they have ordered enough vaccines to vaccinate 5 Australians, five times the Australian population, but still they haven't started. So things are different in different places. So how the bilateral relationships work, how much they are willing to help us, and how much they are willing to leverage power, all these things will come. It's not just one country that produces the vaccine, it's all over. So the government is doing their best to negotiate and get the best for our country. And well, let's see.
Thank you very much, Dr. Pathirana, for shedding light on these matters, of course, concerning these matters of national importance on the vaccination rollout program here in Sri Lanka. Of course, thank you very much to all our viewers out there for tuning in, of course, for sending in many questions today. Once again, thank you very much, Doctor. Thank you very much to our viewers out there. Do take care, stay safe, and God bless.